Hello everyone, and welcome back to the channel. Today we're going to talk about something incredibly common but often misunderstood: actinic keratosis. You might have heard it called solar keratosis, and it's essentially a rough, scaly patch on your skin that develops from years of sun exposure. Think of it as a little warning sign from your skin, telling you it's had a bit too much sun over the years. So, what should you be looking for? Actinic keratoses, or AKs, usually show up on sun-exposed areas like your face, lips, ears, scalp, neck, or the backs of your hands and forearms. They can start as small as a pinhead, or grow larger than an inch across. The texture is often the first clue. It might feel rough and dry, almost like sandpaper. The color can vary, too, from your normal skin tone to pink, red, or even brownish tan. Sometimes they can look like a flat or slightly raised bump, and in some cases they might even form a hard, wart-like surface. It's also common for them to feel itchy or have a burning sensation. You might notice just one, or you could have several in the same area. Now, this is important. When should you see a doctor? The simple answer is anytime you notice a new or changing spot on your skin. It's crucial to get a professional diagnosis. You should definitely make an appointment if a skin patch or lesion is painful, bleeds, itches, becomes inflamed, or if it suddenly grows rapidly or changes in appearance. While an individual AK is not life-threatening, it's considered a precancer, and we want to catch it early. Don't try to self-diagnose based on pictures online. A dermatologist has the trained eye and tools to know exactly what's going on. So, what's the culprit behind these little patches? It's no surprise, the primary cause is frequent or intense exposure to ultraviolet or UV radiation. This can come from the sun's rays or from artificial sources like tanning beds. The UV light damages the DNA in your skin cells, specifically the cells called keratinocytes, which make up most of the outer layer of your skin. Over time, this damage can cause the cells to grow abnormally, leading to the formation of an actinic keratosis. It's a cumulative effect, meaning the damage builds up over many years, which is why AKs are more common in older adults. What happens if an actinic keratosis is left untreated? This is where we need to be really proactive. If left alone, there's a risk that an AK can progress into a type of skin cancer called squamous cell carcinoma. While the risk for any single AK lesion turning into cancer is relatively low, estimates range from 5 to 10% over a lifetime. Having multiple AKs significantly increases your overall risk. Squamous cell carcinoma is usually not life-threatening if caught and treated early, but it can grow larger and, in rare cases, spread to other parts of the body. So, treating AKs is a key step in preventing skin cancer. Let's talk about who is most at risk. The biggest risk factor, as we've discussed, is a history of significant sun exposure or sunburns, especially if they happen during childhood. People with fair skin, red or blonde hair, and blue or green eyes are more susceptible because they have less melanin, which is the pigment that provides some natural protection against UV radiation. If you tend to freckle or burn easily in the sun, your risk is higher. Other risk factors include being over the age of 40, living in a sunny climate, working outdoors, and having a weakened immune system, whether from a medical condition or certain medications. When you visit a dermatologist, how do they diagnose an actinic keratosis? Usually, a doctor can diagnose it just by looking closely at your skin. They'll examine the size, shape, color, and texture of the lesion. They might use a special magnifying lens called a dermatoscope to get a better view. If there's any doubt, or if the lesion has features that are concerning for skin cancer, like being particularly thick, tender, or ulcerated, your doctor will likely perform a skin biopsy. This is a simple procedure where they take a small sample of the affected skin and send it to a lab to be examined under a microscope. This gives a definitive diagnosis. Once diagnosed, what are the treatment options? The good news is, there are many effective treatments. The best one for you will depend on how many lesions you have, where they are, and your overall health. For individual spots, a common treatment is cryotherapy, where the doctor applies liquid nitrogen to freeze and destroy the abnormal cells. Other options for one or a few spots include scraping it away, a procedure known as curettage, or using electrosurgery to burn it off. If you have many AKs spread over a larger area, your doctor might recommend a topical treatment. These are creams, gels, or solutions that you apply at home for a period of weeks or months. Common ones include 5-fluorouracil, imiquimod, or terbinibulin. These can cause some temporary redness and irritation as they work. Another excellent option for widespread AKs is photodynamic therapy, or PDT. For this treatment, a light sensitizing solution is applied to your skin, and after it's absorbed, the area is exposed to a special light that activates the solution and destroys the precancerous cells. What about alternative medicine? While some natural remedies are promoted for skin health, there is no scientific evidence that any alternative therapies can effectively treat or cure actinic keratosis. It's really important to rely on proven medical treatments prescribed by your doctor. Trying to treat it with unproven methods could allow it to progress to skin cancer. Always discuss any complementary therapies you were considering with your dermatologist to make sure they are safe and won't interfere with your medical treatment. Finally, and perhaps most importantly, let's talk about lifestyle and home remedies, which are all about prevention. The number one thing you can do is protect your skin from the sun. This means seeking shade, especially during the peak sun hours between 10 a.m. and 4 p.m. Make broad-spectrum sunscreen with an SPF of 30 or higher a daily habit, even on cloudy days, and reapply it every 2 hours, or more often if you're swimming or sweating. Wear protective clothing like long-sleeve shirts, pants, and a wide-brimmed hat. And please, avoid tanning beds entirely. It's also a great idea to check your skin regularly, head to toe, at least once a month. Get to know your skin so you can spot any new or changing lesions early. Taking these preventive steps is the best defense against developing actinic keratosis and ultimately skin cancer. It's never too late to start protecting your skin. Thank you so much for watching today. I hope this information was helpful and empowering. If you learned something new, please give this video a thumbs up and don't forget to subscribe and hit that notification bell so you won't miss our future health content. Stay safe, and we'll see you in the next video.